Okay. Hi guys, I'm here with Dr. Terry Sidursky from Magnolia Equine, and we are today doing dentals for our horses, our annual dentals. And so he's going to talk, he just finished up with our pony, Paris. He's going to talk a little bit about what he did, and then also then talk about some of the equipment that he uses, and then we'll actually see one being done. All right, Dr. Sidursky.
Okay. Well, what a lot of people don't know on these horses, they have 44 teeth and they grow continually just like a beaver. And they wear them off where they chew. The cheek teeth are offset, so they get sharp dental points on the outside or cheek side of the upper teeth and on the lingual or medial side of the lower cheek teeth. What we do in floating is the level. So we take off that excess tooth that doesn't wear off naturally, so it becomes rounded and smooth and beveled the way it should be. We have incisor teeth in the front, and we actually file all these. These had some little hooks on them that we took off and rounded. And then our cheek teeth are back here. We're going to show you one with an open mouth in a minute, but the bit is going to lie on the bars when you ride your horse. Your cheek teeth start right here, and they go all the way to under the eye. So they're actually very far back in the mouth. You can't see them unless we actually have the horse sedated and the speculum in where you can see all the way to the back of the mouth. But I'm gonna show you some tools here. I'm gonna let this head drop. This horse is sedated, he's okay. The incisor teeth, what I do with my tools, of course you need something, a big syringe to rinse the mouth out. We use some different tools in beveling and working. I start off with a push cut blade. This is actually beveled and angled, so when you do the front 2/3 of the cheek teeth, you can actually get at the right purchase angle to bevel those dental points off. We don't want to file them flat, we actually want to bevel them up the side. So you can take those off and bevel those points off with that angled one. And this one cuts when it pushes. The other bit here, what's neat about it, it's a pull cut. And you'll do the back of the mouth with this because you can go back to the back teeth and you can take those points off coming toward the front. So it actually cuts when it pulls. The tools I use all reciprocate. There's also rotary tools. The rotary tools have a little problem with heat and they can do some thermal damage to the mouth and the teeth. The reciprocating tools, to me, are a better application and you have less tissue damage and they're more horse and user friendly. So that's what I do. When you round and bevel the incisor teeth, this is the blade we use. And as you can see, it reciprocates. You say, well, that looks pretty vicious, putting that in a horse's mouth. Those dental points are enamel. They're very hard. These are carbide blades to grind off those enamel points. So it's actually, you've got to have good equipment and it's got to be sharp equipment to be able to take those points down and get those teeth floated out to where they're leveled out the way they're supposed to. So let's go to, we'll look in the mouth here in just a minute. There's 4 rows, 11 teeth, but all these cheek teeth are the ones that are really important in the back in the floating. The incisor teeth, we want them level and rounded, but these back here are where the problems really occur. And then here's your incisors. When you look at the horse, there's 4 arcades and you start at the top left and you go clockwise. So it's the 100s, 200s, 300s, and 400s. So you've got 401 through 411 and 101 through 111. And that's how we chart out if we have dental problems. Okay? So number 2, this is the other tool I didn't show you, McPherson speculum. And we're going to put this on the horse, and this is how we hold the mouth open so we can get to the back teeth without losing our fingertips. So always leave the halter on in case they run off, even though they're sedated. And we're going to hook him up here in the speculum. Gives teeth in there. Lined up just right. And this is how we hold the mouth open. without getting bit. Just keeping something for later in there, wasn't it? Alright, this is going to be a little head sling, so we can get his head up to where we can look in there and see what we want to see without having to get down on our hands and knees. Rinse some of that food material out so we can get a better view of what's going on. He's got a good bit he's been holding up in there. You're doing good, buddy. You can come look over my right shoulder. You can get a view of how far back those teeth actually go. Kind of a moving target. You can see the points on the outside of those teeth. To the other, you kind of see the difference. If we can get it on the video. You can see how that outer edge is beveled and rounded. He's not a happy camper. Compared to over here, he's still got pretty severe dental points down that outside. This horse has a little bit of a diagonal bite. Smile, where the longest point should be right here in the center, and then it should kind of come up. That side does, but this side, if you'll see, his longest point's over here. So actually this has got to be rounded up. He's chewing just on one side of his mouth. And then if you look at the bottom teeth, they are longer over here. And that makes it, kind of makes his jaw go to the side. See how he doesn't line up? See how he's off center? And what we want to do, we've got to take that down enough and this down enough that he can actually move his jaw both ways. And this also, when he gets this diagonal bite, it puts a lot of pressure on his temporal mandibular joint, and that temporal mandibular joint pain is probably why he kept tossing his head while we had his mouth open. Because when we open that up with the speculum, all this is putting more leverage on his temporal mandibular joint. So we're going to try to clean this up a little bit, and you'll be able to see it really good. This is really kind of a freehand deal. See how it lines up. lines up better. You see here when you look at his upper teeth, the longest point's in the center now, kind of rounded both ways, and see when he closes his mouth, he can actually cross over to chew on either side, whereas before he was being impeded to get contact on both sides. Okay?